It's a beautiful Friday afternoon, the last day of May. Last night, Letitia, my wife, and I had the absolute pleasure and honor of attending Chrysalis, which was the fundraising event for Face the Future. For those of you that don't know, Face the Future is a Canadian not-for-profit started by Dr. Peter Adamson, a facial plastic surgeon, colleague, and mentor of mine. And Face the Future funds surgical missions to decrease the surgical burden of disease throughout the world, namely right now, Ukraine, Ethiopia, Nepal, and Rwanda. So last night we were able to take part at the Carlu in Toronto in a beautiful evening to raise money for Face the Future, because it is not cheap. It is very expensive to perform high quality, safe surgery, and that's what we aim to do. So as promised on Wednesday, I said that I would go over why does surgery cost so much money? Why does cosmetic surgery cost so much? And I wanted to kind of break that down onto kind of where those dollars go. And so when you get a quote for a cosmetic surgery, there are a lot of things that go into that quote. Not only are we talking about what materials do we need for the surgery, what equipment do we need for the surgery, what support staff do we need for the surgery, how much time do we need for this surgery, but there's a lot that goes on behind the scenes. And so I'm gonna back it up all the way to the very beginning. When somebody sends an inquiry into our office, I have two patient care coordinators, Gigi and Megan, and they will do a comprehensive phone call to answer any questions that you may have and to gather all of your goals so that when you come in, you're completely prepared. What we want to avoid is people coming in kind of unsure of what bothers them and then becoming overwhelmed if we go over a multitude of things that are possible that they may not be interested in. So you have to be able to articulate what bothers you. And then Gigi and Megan will go through sort of options, surgical and non-surgical. And then once you are kind of ready and feel like you have the information you need, they will bring you in to clinic to meet me to discuss to see if you're actually a good candidate for that. And so after that, if we do go ahead with booking surgery, we have Donna, our charge nurse, downstairs in Guelph Surgical Suites, who will do a comprehensive phone call with you to take your medical history in terms of anesthetic preparation and recovery. And part of that is supported by both my wife Letitia and Kate in terms of all the paperwork, the blood work, the forms, things that have to be done. And so you have all these people already involved before you even had surgery. On the day of surgery, there are a number of people involved. There are a number of people taking care of you. Of course, there's me, the surgeon. And then there's Jocelyn, who is our clinic nurse, but also my surgical assistant scrub nurse. We have a circulating nurse, who's usually Kelly. We have a recovery room nurse, and we have an anesthetist. And so that team of people is there for you, is there to make sure that you're safe, that you're comfortable, that everything goes as smoothly and safely as possible. And then behind the scenes, we have our MDRT, our medical device reprocessing technicians. We have two here at Guelph Surgical Suites. We have Dimitri and Mike. You can see Dimitri here, cleaning the instruments, sterilizing the instruments, checking the sterilization logs to make sure that all of the parameters were met so that we can keep surgery safe. And so those are the people, the bare bones people that are involved. But what about the infrastructure? Well, of course, to do surgery, you need space to do that. And so setting up space, you have just the square footage lease or mortgage to have the space, but there's also the infrastructure that goes into the HVAC system and to the gases. And so for a safe surgical OR, North American hospital standards, you need 12 air exchanges per hour. You need to have positive pressure in your operating room, and you need to maintain the temperature in a pretty strict range. And so all of that is done through a lot of HVAC equipment, which is hidden in the basement here at 834 Gordon. We also have all of the anesthetic required gases, so oxygen, nitrous, and medical air piped up from the tanks, from the reserves, so that we have more than enough all of the time. We also have the anesthetic gas scavenging system and surgical suction so that we can deal with any issues in terms of bleeding, or maybe somebody's coughing and has a lot of mucus that needs to be suctioned. And so that is a hospital industrial grade system. And all of this equipment requires maintenance and upgrades. What if the power goes out? Well, we have a massive generator that comes on instantaneously if the power cuts to ensure that you are safe the entire time. It's natural gas, so it doesn't have to be refilled with diesel or anything. So it's an instantaneous safety feature for the entire building to make sure that if the power goes out, we can continue, we can do things safely, and you will not have a problem. And so when you take all of those factors in, and then you take your surgeon's time, the front desk staff involved in bringing you in for a consultation and arranging for your follow-ups, the time it takes to take care of you after surgery in terms of suture removal and laser treatments for your scars and the silicone scar gels that we use for incision lines to help them look better faster, and sometimes CO2 laser and sometimes little minor tweaks. All of those factors get put together in what makes the final price for your surgery. So I hope that that helps. I want to kind of get rid of the illusion that maybe you see that price for surgery and you think that that's all going into your surgeon's pocket. It's not true. It's being used to take care of you, and that's really what surgery costs, and that's cheaper than what it costs at the hospital in most cases, because we run a pretty lean kind of system here, and most private clinics do, without a lot of administration costs. But those are the bare bones. So I hope everybody enjoys the last day of May. Have a beautiful first weekend of June, and we'll see you next week.